Well, thank you everyone for being here today. We're really excited because we're going to talk here about the getting our economy going as safely as possible. And with us today, we have Tim O'Neill, the President and CEO of Goodwill of Central and Northern Arizona. Thanks, Tim, for being here. Mona Stone, their Senior Vice President, General Counsel, and Chief Compliance Officer and Corporate Secretary, and Dr. Anna Moran, the Clinical Associate Professor of Infectious Diseases at Barrows Neurological Institute. So some of the greatest folks we know, and we're really excited to have you on. I also have Court Rich, who's involved with the HealthyVerify Certification program, and let's just get into this. Tim, I know you're here on the phone because you're sitting in one of your parking lots of one of your newly opened stores, and you're visiting all of those this week, which is great. You're one of the largest Goodwill's operations in the country with 100 stores here in Arizona, and you needed to figure out how to safely keep the thrift operation going in order to support the essential job training services that Goodwill provides. So I thought maybe first tell us just a little bit about what Goodwill does with the money they make from the thrift operations and how that job training has been impacted in this unemployment crisis.
Yeah, certainly. And thanks for having us today. We really appreciate it. You know, a lot of people really don't understand what Goodwill is all about. And we're truly one of the oldest not-for-profits in the country, started in 1902. It's been in Arizona for over 70 years. And our mission really is to put people back to work, help them find the job training, the skills that they need, and then connect them with employers to make sure that they have the best livelihoods that they can. We don't take a lot of federal or state monies. As a matter of fact, 99% of all of our funding comes from our retail thrift stores. And when you clean out your closets, you're actually helping put somebody back to work. And that meant last year that we served about 70,000 people, helping them find jobs, providing 180,000 plus services completely free of charge to anybody in the community that wants them. And those services are provided through our career centers throughout the state, also through our virtual services at mycareeradvisor.com. And so really, you know, for us, seeing what was happening with the economy, seeing what was happening with employment and unemployment, it was pretty clear that that we were going to start seeing massive amounts of people start coming to us looking for assistance. People don't really realize that when people file for unemployment, almost always one of their next steps is to come to Goodwill. We partner with DES, we partner with unemployment to actually help those folks once they file, then get in and try to get back into the workforce as quickly as possible. And we saw that coming. Sure enough, that's exactly what happened. And so because of that, and because all of that work is funded through our stores, we needed to figure out a way to get our stores reopened in the safest way possible. You know, our first concern is always the safety of our customers, our donors, our teams. And so, you know, working with the Rose Law Group and trying to figure out what that looked like, and then with Barrow and Dr. Moran and trying to figure out, you know, what was safe operations in a retail environment and even more so in a thrift environment. And so, you know, all these procedures were really a work in progress, took a lot of time, but really has helped us reopen. We have 41 of our stores open right now. And in just a little over a month, we've already seen 11,000 plus people come into our career centers looking for that help to get back to work. So clearly the two needs were served in getting the stores open and then being able to take care of all those folks and hopefully get them back to work as quickly as possible. So thanks again for helping us with that.
Of course. Hey, Tim, you said 11,000 people came to your job services this month. What is normal? How many?
You know, normally in that same time for what we're looking at, it would have been maybe a quarter of that, and trying to figure out, you know, exactly who was new and who wasn't. Some people come back to us for repeat services, but, you know, for us, 11,000 is certainly a record. And what we think is going to happen is, you know, that's really from probably the first real week of people being out of work. We think the numbers over the next month are probably going to double that and then continue to grow from there. So it will certainly be a year where we think we'll see at least 300,000 services provided to folks out in Arizona, and that's far and away going to blow away any record we've had previously.
Oh, wow. Well, thank you. We could not be more honored to help Goodwill, and we were really, really happy that you're serving the community and that you were deemed an essential service by the governor, and that you're back on track there with this HealthyVerify certification. Before I go to Dr. Moran for a minute, Rich, why don't you just tell us a quick 1 or 2 minutes about what HealthyVerify certification is, just so that the context is laid for Dr. Moran to talk about her experience.
Sure, thanks, Jordan. So HealthyVerify Certification is a company that's, the goal is to help America get back to work. And what we do is we work with doctors like Dr. Moran to put together procedures specifically for each business that comes to us. These procedures will help that business establish a environment that's safer than it would have been without those procedures, to reduce the chances of diseases being spread. And then we go in, if they implement them right, we do a inspection and we certify the company as having implemented those procedures in the right way. That's the short version of it.
Thank you. Okay, and so the first company that has been certified is Goodwill of Central and Northern Arizona, and they were certified just this last week. Dr. Moran was there with us on an inspection, and it was really cool. So thanks for that. Now you're working with hotels, casinos, home builders, cities, theaters, event venues, et cetera, et cetera. But I wanted to talk to Dr. Moran first about, you've been involved your entire career in wellness and health and making sure people get better through great medical procedures. And I wanted to understand, is it exciting for you or your involvement to help sort of fix the second crisis, which is the unemployment crisis? Talk to us a little bit about that experience for you as a doctor.
Absolutely. And as soon as Dr. Lawton, the president and CEO of Barrows Neurological Institute, approached me for this project, I jumped in. It's right exactly where my expertise the last 14 years has been, which is infectious diseases and more precisely infection control. And this is a very unique, unprecedented circumstance in terms of not only an infection and a pandemic, but it has affected beyond just the health of our community, as well stated. It has also affected this very important aspect, which is the financial aspect of, or the financial well-being of the community. And so helping tailor the needs of each institution or business, in this case, Goodwill, with a great first project to start with because of the impact it has in the community, as I stated before. And also because, again, even though there are regulations from OSHA and CDC in terms of how to provide a healthy environment for employees and customers, because of the uniqueness of the epidemiology of this virus, all these recommendations have to be revised. And what is also very important that was very clear in the process is that because it's a very variable situation, these standards have also to be reviewed through the time as we get to know more and more about the epidemiology of how this disease is transmitted and how to keep both employees and customers safe. So it was really, it was challenging, but at the same time, really fun and rewarding to participate on this project with HealthyVerify.
Well, thank you for your work on this. It's been a wonderful working relationship, and I think that your point is well taken. These certified companies will be getting continually revised advice throughout the next 12 months, because that's how long the certification lasts before renewal, as to things that may change, right, over time. And
Absolutely.
We think not only that medical things may change, but also just good practices may change. Like you could be wearing a mask today, but maybe in 3 months, there's some different kind of advice on that you'll be giving through HealthyVerify.
Correct, and it's a moving target in terms of the recommendations to keep people safe as we learn more and more about how the disease is transmitted and how it is prevented. So it's beyond what's done in the hospital.
And Dr. Moran, just a quick follow-up is, we're concentrating quite heavily right now, obviously, on the COVID-19 virus, but will this particular certification help with other sicknesses and illnesses in workplace or employees or those kinds of things?
In general, yes, provided that we're talking about the same type of infections. Certainly, there are details that I'm also happy to discuss and that we've discussed briefly on our last meeting about how to prevent other types of illnesses. As it turns out, everything that's done to prevent this kind of viral transmission actually helps on other infections as well. And that has been shown in studies from China, particularly.
Thank you, Dr. Mona. I want to talk to you a little bit about some of the specific procedures that we worked back and forth, HealthyVerify Certification worked back and forth with the doctor's advice and Goodwill's input, because it doesn't do us any good to give you procedures that you can't implement. And Mona, you were really ran point on that and had such good feedback on not only on operations, but on legal issues and the like. So we very much enjoyed working for you, Mona. Maybe you could talk to us just a little bit about some of the things that Goodwill has put in place for the customer.
Absolutely. And thank you so much for this relationship and your partnership. It's been absolutely invaluable in strengthening our brand. And we fully appreciate and understand that shoppers as well as donors may have concerns in returning to any retailer right now. So we're taking important precautions that we developed in partnership with you to, as we reopen our stores and donation areas, we want to make sure that our employees and our customers are safe, they're protected, and they are comfortable coming back in. So when we did close, we were able to do a deep, thorough cleaning of these stores, and we've implemented several safety precautions. First, customers do not have to get out of their cars to donate their items as they come through our drive-thrus. All donation attendants will be wearing gloves and masks. Customers, if they do wish to get out of their vehicles, donation bins will be placed 6 feet from any of our attendants so that social distancing is preserved. We're sterilizing the donated items with a disinfectant spray that's called SteriFab. And then all retail workers also are going to be provided masks to wear. And then we're going to continue to disinfect the stores, especially high-touch areas, multiple times a day, whether this is the door handles, dressing rooms, etc. And then we're practicing social distancing recommendations. We are asking customers not to shop within 6 feet of each other. They're being very helpful in that regard. And then we're marking our floors near checkout lanes so that there is also at least 6 feet of separation between customers. And again, that's being favorably received by the public. And then lastly, we are placing plexiglass sneeze guard partitions at checkout counters and limiting the number of customers that actually are permitted in a store at a given time to make sure that we're not overcrowding and risking that exposure. So very thrilled to have partnered with HealthyVerify on this.
Thank you, Mona. Thank you. Tim, can I talk to you a little bit about what's been the most surprising thing, both from your customer perspective and maybe your employee perspective as well, as you've dealt with this and the reopening of the stores?
You know, I've said this to a lot of people in the last probably, I don't know, few days, last week maybe, but I am amazed at how grateful people are. And, you know, I've been doing this pretty much all of my life, over 30 years in this business specifically, and I have never seen our customers be this understanding of new policies and procedures. It seems like the world understands there's a bit of a reset going on, and we're going to have to live in a bit of a different way, at least for the time being. And they're very receptive to that. You know, as Mona talked about the social distancing, we have at our cash register lanes, they're marked off 6 feet apart so that people aren't standing right next to each other as they're waiting in line. And I've been amazed, people are standing right on the lines. You know, people have also, we've also heard from all of our store teams that the customers are just being extra friendly and very, very grateful. I think the customers are extremely grateful that we're open. And, you know, I've said this before, I don't think people realize, but, you know, if you're somebody that's earning minimum wage, or especially if you're somebody that's unemployed or has been unemployed for a period of time, you know, the difference in buying a pair of shoes at a traditional retailer for your child versus buying a pair of shoes at Goodwill for $5, that's the difference in somebody being able to feed their family for a day or two. And so it is important, and I think our customers are extremely grateful that we're providing that service to them. In addition, the teams, oh wow, the morale is, I've never seen it this strong. I just left a store earlier, and people were coming up and thanking me for reopening. and just how much they appreciated us calling them back, because we did have to shut down for a short period of time, and having them come back to work. And even talking to one of our store managers, his response was that people are more willing now than ever to jump in and do things that aren't normal. Like we have, our extra cleaning precautions. We will have our people that normally work in our production stockroom areas, we'll stop them at certain times through the day to go out and make sure the extra cleaning is being done over and above what we've already committed to, just to make sure that the stores are as spotless and as clean as they can be. And people are just willing to jump in and do that. So I think that, this crisis has been a terrible thing, but I will tell you that, at least from what I've seen, the humanity that's coming out on the other side of it, of the way that people are treating each other, is something pretty special. And I don't know if that's just what I've observed or our business. I hope not, but it has been something that surprised me.
And us too, frankly. So that's been neat to see, especially in your stores. You've said that, and then we got to go there, and we saw people being excessively friendly to each other, and probably pretty stressful situations for everybody. Dr. Moran, I wanted to ask you, you're now dealing with other sort of operations, event centers, sports things, hotels, home builders, cities, all those kinds of things. How are you looking at evaluating different operations? How does that play in your mind as we go through and certify various businesses throughout the country?
Well, I come from the scientific epidemiological standpoint of obviously, I don't have training on employee safety or OSHA procedures the same way the corresponding operating officers for the companies are. But what I'm trying to do is put together or find the point where we can apply those OSHA regulations and tailor them in terms of responding to how very different this virus behaves compared to other situations that threaten the safety of employees and customers. And I apply the science and what's known so far and modify it as more knowledge is acquired about the virus and its transmission, and apply it to the specific environment that we're trying to help improve safety in.
Thank you. Thank you. And Mona, I'm wondering, from a general counsel, vice president, of the business, the compliance officer, how are you looking at how have your employees reacted to these new safety procedures when you rolled them out and said you're going to be wearing masks for at least a period of time? What kind of reaction did you get?
I think admittedly it was an adjustment for some folks, but I really believe with your help, with Dr. Moran's help, we've done an excellent job in messaging the importance of this and why it is so critical to take these safety precautions. It's in their best interest. And I think once you get them invested in it, then they realize, yes, this is important. Frankly, it's so that we can not only self-preservation, but the preservation of our customers and our donors. And that's only good for everybody. So I think they've actually a little bit of adjustment, but once they've been trained on it, they become familiar with it. It's second nature now.
Tim, I thank you, Mona. Tim, I know you talked to me at one point about, I think a country, maybe it was Korea or something like that, when their country kind of reopened for business after maybe it was SARS, that the thrift retail proposition went way up. Can you tell me a little bit about that? Because I found that pretty fascinating, and I'm sure I got the facts wrong there.
No, you're pretty close. It's actually in South Korea, the Goodwill there, when it just reopened after being shut down from COVID-19, they saw an immediate jump in business. And so, and actually, I believe we're going to see the same thing once we fully reopen, because right now our business is only off a few percentage points from what it was pre-virus, and we're operating on diminished hours. And so what South Korea saw a dramatic jump in their revenues, and I really believe, based on what we're seeing so far in our reopening, we're going to experience the same thing.
Good, and we're hopeful that you will, because it seems like the job training services are clearly now ever more important. Mona, talk to us about if you're a donor to Goodwill, if you've just cleaned out. I think everyone's hanging at their house and cleaning out stuff and dropping them. What's that experience now like? How is it a little bit different than it was before? How fluid is that? Give us some idea of that.
Yeah, when we've been out to the stores, and Tim can attest to this, our donation drive-throughs and our queues are busier than they were pre-coronavirus, and it's very smooth. It's seamless. You will not have additional wait times or anything like that. The team, again, they've adapted very quickly to the new procedures, understanding the social distancing, and we have just seen a huge uptick, and we are very, very appreciative to that and glad to be there for the community. So that's been sort of a silver lining in all of this.
Dr. Moran, talk to us a little bit about what measures hospitals are taking. I know, and this is a little bit off of the Goodwill topic, but I know there's some people who have said, oh gosh, you know, I'm a little frightened to go to a hospital here right now because who knows? And just give us a quick background on that. I saw a private message about that.
Starting from the emergency room operations, there is a separate area where respiratory symptoms, patients coming with respiratory symptoms are addressed for obvious reasons. Everyone is assumed to be potentially a COVID-19 case until proven otherwise or until evaluation is done. In terms of the healthcare workers, we're all evaluated on a daily basis or every time we come into the buildings with temperature check and symptoms screening. Obviously, anyone who does not pass the scrutiny will be sent home for obvious reasons. At the hospital operation levels, most hospitals have freed up non-essential, non-urgent operations to make room for potential new cases, both at the ICU and the regular floor levels. There's also social distancing with only essential workers being in person and those who can telecommute at work from home. And also there's a very severe limitation in terms of the visitors, both in numbers and time to prevent bringing the infection to the patients. There's constant symptom screening, doubled up in terms of the cleaning up of the environmental cleaning, etc.
Thank you. Thank you. Well, and I know that you've taken that experience and really applied it in a non-medical facility like Goodwill, which has been awesome.
Absolutely. In fact, the employees at Goodwill get the same kind of scrutiny that healthcare workers do on a daily basis.
And thank you for that. And thank you, Mona and Tim, for implementing. At court, Rich, just talk a little bit about the standards and how they differ from the CDC or what have you, or maybe the doctor can talk to that.
Yeah, I'll start and then I'll let the doctor talk to it too. But the idea of the procedures is not to replace the health code or any federal standards that are out there. The idea is to look at each individual business and figure out what they can do above and beyond or different or unique for their own operation, so that when you go to a Goodwill and you see that they're certified, that they've taken the time to not just do the minimum required by law, but to think about what can we be doing better, different on our at our business in order to give as much of a good feeling of safety. The idea is not to eliminate, and will never eliminate, the ability of diseases to be transmitted at a facility, but the idea is to make it safer and to reduce those chances.
And restore public confidence, I think.
Absolutely.
Yeah. Doctor, do you have anything to add to that?
Only to reemphasize that, again, we have taken the requirements by the regulatory agencies and added extra based on what we learn constantly about how the virus is transmitted, and based on studies, and sort of added on to the minimum requirement. So it's actually, as you've said before, going beyond the minimum requirements by the regulatory agencies.
Thank you. And Tim, let's circle back to you. And I know we just have a half an hour today, but if anybody has questions, they can certainly contact me or Court or any of the people here, or go to HealthyVerify.com and send an email. Tim, just in terms of you're going forward and Goodwill, Central and Northern Arizona, being a leader in all sorts of spaces, and now in the space of getting people back to work, not only through your job training, but through this program where you're really upping your standards. How do you feel about that, and what kind of thoughts are going through your head with regard to that national leadership role that you've just really taken on?
Well, really, there's a lot of pride in it for us, and we also feel a sense of responsibility in that, you know, we have committed to things that are far above just the general recommendations, but we did that really because it was the right thing to do. I would hope that you'd see many other businesses out there start following these same things, using the HealthyVerify kind of model, and really, you know, it is for the safety of all of our customers and our teams. And if we're not focused on that, then I'm not sure why we're doing any of what we're doing, especially being Goodwill. So really just a pride position, wanting to share the information. I had a chance, I presented on a webinar yesterday to all the Goodwills around the country, and talked about, you know, our standards and what we're doing and what's so different here than most other places. We are the first ones to reopen around the country. And again, I believe we're the safest as we do that, those reopenings.
Thank you, Tim, and thank you to Dr. Moran and Mona and Tim and Court. I just we're really honored to be able to help Goodwill. It's really a blessing, and frankly, I think one of the best things if not the best thing I've gotten to participate in my life so far.